learning objectives, and the learning objectives are to discuss, to recognize the bones of hand, to identify the features of the bone present in the hand, and to discuss the clinical significance of the bones present in the hand. So going with the first hand, hand is a distal portion of the upper limb. We can say our hand is lying distal to the wrist joint. So this is hand, which is the most distal part of the upper limb. So this hand is not made up of just single bone or fewer bone, but it is having multiple bones, and these multiple bones are grouped into three categories. They are carpal bones, there are metacarpal bones, and there are finger bones, which are called phalanges. So these are the three categories of the bones present in the hand. So there are carpal bones, short bones, then there are metacarpal bones, and then phalanges. So these are the three categories of the bones of the hand. So the number of these are, there are 8 carpal bones, and then there are 5 metacarpal bones, and there are total 14 phalanges, the bones of the digits or fingers, you can say. So there are 14 phalanges, 5 metacarpals, and 8 carpal bones. So this image is again showing the carpal bones, metacarpal bones, which are 5 in number, and phalanges, which are 14 in number. So going with the carpal bones, there are about 8 carpal bones, which is the first or the proximal portion of the proximal part of the bones of the hand. So there are about 8 carpal bones, and these 8 carpal bones are present in 2 rows, 4 bones in each row. So there are 4 bones in the proximal row, and there are 4 bones in the distal row. So there are 8 carpal bones present in or arranged in 2 rows of 4 bones. Again showing the image of the carpal bones. So and in this image you can see these carpal bones are present distal to the radius and ulna, and proximal to this proximal to these metacarpals, and distal to the radius and ulna. So these are the 8 carpal bones. Going with the first row. In the first row we are having the proximal row, we are having 4 bones, and they are scaphoid, this one, then lunate, triquetrum, and pisiform. So these 4 bones are present in the proximal row. Again repeating, scaphoid, lunate, triquetrum, and pisiform. Then going to the distal row from lateral to medial side, there is trapezium, trapezoid, capitate, and hamate. Sorry. Again reviewing these names. The distal row from lateral to medial, there is trapezium, trapezoid, capitate, and hamate. So these are the 4 bones present in the distal row. Going with the characteristics of these carpal bones. These carpal bones, which are the short bones, among them the first bone from the lateral side is the scaphoid, present in the proximal row. So this is scaphoid bone, and you can see here this is board shaped bone. It is having a shape of board, and it is the largest bone among the first row of the carpal bones, or the proximal row of the carpal bones. So this is scaphoid. It is having a shape of board, and it is the largest of the proximal row among the carpal bones, and it is articulating proximally with the radius. And on its lateral aspect, on the palmar side, there is a tubercle present on the scaphoid, that is called tubercle of scaphoid. So this is the features of a scaphoid bone. It is articulating proximally with the radius. It is having the shape of board, and it is largest among the first row bones. Then comes lunate, the second bone, which you can see here. Lunate means moon. So this is crescent or moon shaped bone, and this is articulating again proximally with the radius and also with the scaphoid. So this is the lunate bone. Then comes the triquetrum. It is the pyramidal shaped bone having three-sided bone, triquetrum, present on the medial side of the carpal bones. It is having oval facet on the distal part of the palmar surface, and it is articulating proximally with the articular disc of the distal radioulnar joint here. So the triquetrum is articulating with the distal radioulnar joint, articular disc of the distal radioulnar joint, and this is pyramidal shaped bone. Then there is a small bone called pisiform, this one. Pisiform is a pea-shaped bone, very small, that is lying on the palmar surface of the triquetrum. So here is a triquetrum. On the palmar surface of the triquetrum, there is a pisiform bone present. So these are the 4 bones of the proximal row. Again, revising, this is a scaphoid bone having the board shape with a tubercle on its lateral aspect, articulating with the radius proximally. Then there is a lunate, which is a moon-shaped bone, also articulating with the radius proximally. And then there is a triquetrum, that is a board-shaped bone having 3 sides, and on the palmar surface of the triquetrum there is pisiform bone present, and this triquetrum is articulating with the distal articular disc of the distal radioulnar joint. Then these are the bones of the distal row: trapezium, trapezoid, capitate, and hamate. So starting with the characteristics of the first trapezium bone from the lateral side of the distal row. Trapezium is quadrangular in shape, means having 4 sides. So this is trapezium. It is having an tubercle which is present on its palmar side. So this is the tubercle over the trapezium, and this is the trapezium bone. This trapezium is articulating with the first as well as second metacarpal bone. You can see here. So this is trapezium. Also it is articulating with the scaphoid and trapezoid. So this one is the trapezium, quadrangular in shape, having 4 sides, and on its anti-aspect it is having a tubercle, which is its characteristic feature. Then comes the trapezoid, wedge-shaped bone. You can see here, articulating with the second metacarpal bone and also with the trapezium and capitate. So this is the small bone, trapezoid. Then there is a capitate, which is head-shaped bone with rounded ends. So this is head-shaped bone, and it is the largest bone among the all carpal bones. So the capitate is the largest bone among the all carpal bones, and it is head-shaped bone having rounded ends, and it is articulating with the third metacarpal bone and also with the scaphoid, with the lunate, with the trapezoid. So this is the capitate. Then comes the last bone of the among the carpal bones, that is the hamate. Hamate is again wedge shape, and this is articulating with the third and fourth metacarpal bones, and on its palmar surface it is having a hooked process that is called hook of hamate. So that is the most prominent feature of the hamate. On the palmar aspect, it is having a hook process called hook of hamate. It is articulating with the fourth and fifth metacarpal bone, and also with the triquetrum proximally. So this is the hamate. So these were the bones. These were the 8 bones of carpal bones. Again revising: scaphoid, board-shaped bone, lunate, triquetrum, and pisiform. Then trapezium, trapezoid, capitate, hamate. So these are the bones. Then comes the metacarpal bones. So metacarpal bones are actually making the main skeleton of the palm of the hand. If you can feel your hand, you can see or feel the metacarpal bones, which are making the main skeleton of the palm of the hand. And these are the miniature long bones, and they are present distal to carpal bones and proximal to the phalanges of the fingers. So in between the carpal bones and phalanges, 5 metacarpal bones are present. So these metacarpal bones are having features. They are having proximally base, and the base are articulating with the carpal bones. Then they are having a concave shaft, and distally they are having head which are rounded, and they are making the knuckles of the fingers. So they are having base, shaft and head. Proximally base, then shaft, and distally they are having head. Heads are articulating with the phalanges. So among these metacarpal bone, the first metacarpal bone is the thickest and the shortest of all the metacarpal bones. So first metacarpal bone is shortest and thickest, while the third metacarpal on its lateral aspect is having a styloid process, which is the characteristic feature of the third metacarpal bone. So these are the features of the metacarpal bone. They are having base, they are having shaft, and they are having head. Heads are rounded, articulating with the phalanges. Bases are articulating with the carpal bones. And the first is the shortest and thickest among the metacarpal bones. And the third is having a feature called styloid process. Then comes the phalanges. Phalanges are making the main skeleton of the fingers, or digits you can say. And each finger is having each digit is having 3 phalanges, except for the thumb, which is having only 2 phalanges. So these are the 4 fingers which are having 3 phalanges in each, while the first is having the only 2 phalanges. Hence there is a number of 14. So each digit or each finger is having 3 phalanges, and they are arranged in row. There is a proximal phalanx, there is a middle, and then there is a distal. Proximal one is the largest, then there is a the middle is shorter than the proximal, and distal is again more shorter than the middle. So these are their size is just like tapering. So these are the phalanges: proximal, middle and distal. And they are again having the same features: base, shaft and head. Base is present proximally, then there is a shaft, and the head is present distally. So these are the features of the phalanges. So these were all about the osteology of hand. And going to the clinical significance of the bones of the hands, among them we are having carpal bones, and in carpal bones the fracture of a scaphoid is common. So among the carpal bones, scaphoid is most commonly fractured bone, and it can result when the person is falling on its abducted hand. So that can lead to the fracture of scaphoid. Then lunate dislocation is again common clinical condition among the dislocation of the hand. And in this radiograph you can see this is the normal radiograph, and in this radiograph you can see the lunate is in its here aligned position, while this radiograph is showing the affected one, in which you can clearly see the lunate is dislocated. Then fracture of metacarpal. All the metacarpals except for the first, that is a thumb, are bound together, and you can feel them. They are bound together in the palm. So if they are going to fracture, and there is a strong severe crushing injuries can result in their fracture, and these fractures are more stable as they are bound together and they are having a good blood supply that will lead to their rapid healing. So these are the metacarpal bone fractures, and if among them the 5th metacarpal bone fracture is known as boxer's fracture, and it is occurring when the person is punching with his closed fist in abducted position. Then this can lead to the fracture of fifth metacarpal, and that is known as boxer's fracture. And here in this radiograph you can see the fracture. Here is the fracture of the first metacarpal bone, and this is called Bennett's fracture. So Bennett's fracture is the fracture of first metacarpal bone, and that is the most common fracture of the thumb, and this can also involve the carpometacarpal joint and also lead to the dislocation or subluxation of the carpometacarpal joint. So this is the Bennett's fracture. So this was all about